hypertension. We will never understand drug therapy of hypertension unless we know the basic physiology, how the BP is controlled. So, BP is cardiac output multiplied by peripheral resistance. And we know very well that the cardiac output is equal to heart rate multiplied by stroke volume. It means BP is equal to heart rate multiplied by stroke volume multiplied by peripheral resistance. This is the basic physiology of hypertension. So if you know that there are three things which are going to govern or control BP, and once your physiology is strong, then you are going to use the drugs which can control these parameters. So friends, this was the physiology of parameter heart rate are beta blockers. And the new drug is evaporating. Right? Now, what are the conditions where we will be using beta blockers, to be more precise? So this was the pharmacology. So in medicine side, clinical side, the medicine side, the indication. Beta blocker we use in coronary artery disease. We also use in case of hyperthyroidism. And in hyperthyroid, specifically we use propranolol because the propranolol has a additional quality of inhibiting T4 into T3 conversion. This inhibits T4, T3 conversion, and T3 is the active hormone. Now we talk about the parameters which are going to reduce the stroke volume. So before I discuss the drugs, let's learn some basic concept about the stroke volume. Well, end diastolic volume of each ventricle is around 100 to 120. But for easy calculation, I am taking 120 ml. And the end systolic volume is 30 to 40, but for easy calculation, I am taking 40 ml. So it means what? In each stroke, around 80 ml blood goes out. And this is known as stroke volume. Okay? And after 120, 80 ml goes out. That means approximately 66.6% goes out. And this is known as ejection fraction. And ejection fraction very easily we can detect by echocardiography. So this is about the stroke volume. This was the basic physiology of stroke volume. Now we talk about pharmacology. Drugs which are going to control stroke volume. Again, beta blockers. So beta blocker reduce the heart rate They also reduce the pumping action of the myocardium. That means beta blockers are primarily going to control cardiac output. Second drug which control stroke volume is diuretics. How come? Because they reduce the intravascular volume, so preload is reduced. They reduce the preload. And nitrates, they dilate the peripheral venules. So whole blood is pooled into peripheral tissues. It also reduces preload. It means both these two drugs, they are reducing preload. Diuretic by reduce intravascular volume, and nitrate by dilating the peripheral venules. So now where we use diuretic, now we come to medicine indication. So indications are hypertension with CHF, hypertensive emergency. In hypertensive emergency, we use nitrate. Okay, nitrate as an infusion we use. And of course, hypertension with CAD, we also use nitrate. Right? So this was regarding drug which control the stroke volume. Now we talk about drugs which are going to control the peripheral resistance. So before I discuss the drug therapy, let's learn some more concept about physiology. BP, peripheral resistance, is 1 by R4. 1 by R4. R is the radius of the arteriole. We all know the primary site of peripheral resistance is arteriole. So here is the arteriole. And here we have alpha receptors. Here we have beta receptors. In the normal physiology, alpha are vasoconstrictor, beta are vasodilators, right? So when we give beta blocker, there will be unopposed alpha action, and that will lead to what? Vasoconstriction. But if you give alpha blocker, there will be unopposed beta action. The arteriole will dilate, peripheral resistance will come down. That's the basic physiology. So point to be noted in the physiology, peripheral resistance is 1 by R4. So if you dilate the arteriole, peripheral resistance will go down, BP will go down. This was the physiology. Now we come to pharmacology. Drugs which reduce peripheral resistance are alpha blockers, I just told you, and alpha blocker are used in which conditions? Especially elderly males. Why? Because not only they will control BP, but they will also help in the urine outflow in benign prostatic hypertrophy. We can also use in case of hypertension with CRF. Second drug which reduces peripheral resistance is calcium channel blockers. And calcium channel blocker are used in scleroderma. We can also use in case of chronic renal failure. We also use nimodipine in subarachnoid hemorrhage. And the purpose of nimodipine in subarachnoid hemorrhage is mainly to prevent the vasospasm. which is a big problem in subarachnoid hemorrhage. Third drugs which reduce peripheral resistance is ACEI, and in fact this is one of the most widely used drug for hypertension. So we use in young hypertensive, we use in unilateral renal artery stenosis, we use in hypertension with diabetes, hypertension with CHF, or patient having sexual problem or erectile dysfunction and hypertension, we use ACEI. The fourth category of drug is direct vasodilators. The direct vasodilator, they include hydralazine, alpha methyl dopa. Alpha methyl dopa. These two drugs, they are the drug which have been for ages we are using for pregnancy with hypertension. They are a safe drug in pregnancy with hypertension. And point to be noted, ACEI are absolutely contraindicated in pregnancy because they lead to fetal wasting. And the third drug, which is a direct vasodilator, is sodium nitroprusside. Sodium nitroprusside. It's a wonderful drug. It is the one drug which dilate the arteriole and dilate the venules. That means it will reduce the preload as well as afterload. It's a wonderful drug for hypertensive urgencies and emergencies. One of the biggest advantage of this drug is very wide safety margin. So it's a wide range. You can use as high 0.5 to 8 microgram per kg per minute. Just see, wide safety margin. And it's a very effective drug, very fast acting drug. That's why this drug is being used for 30-40 years for hypertensive emergencies. So friends, to conclude the whole show, let's revise the entire management of hypertension in just 30 seconds. You have to control 3 parameters: heart rate, stroke volume, peripheral resistance. For heart rate, we use we use beta blocker or ivabradine, and for stroke volume, beta blocker, diuretic or nitrate. And for peripheral resistance, we are using alpha blocker, calcium channel blocker, ACI, and direct vasodilator like hydralazine, alpha methyl dopa, and sodium nitroprusside. And if you have any queries to ask me, you can post the question via messenger, and I invite you to join Dr. Bhatia Medicine Forum so that we can talk, we can communicate more about medical problems. Thank you very much for watching this video.